talk briefly about food allergies and sensitivities. And food allergy, of course, we know it's when there's a severe and acute and a strong immune reaction that leads to release of histamine. And it ranges between mild, like hives, itchy mouth, to severe reaction, swelling, difficulty breathing. There's 32 million Americans that have food allergies, about 1 out of 10 adults, and 1 out of 13 children. So it's quite prevalent. And of course, anaphylaxis is our shock, massive release of histamine, life-threatening situation. And each year, about 200,000 people require emergency medical care because of medications that led to this reaction, exposure to latex, eating food that they're allergic to, and epinephrine is used in emergency situation. So understanding food allergies is really exposure to the food. Immune cells create antibodies. And then you have IgE, immunoglobulin binds to mast cells and activate them, and they secrete histamine, and that leads to the symptoms of allergic reaction. That also includes asthma. That also includes many of those reactions. And then antibodies, IgE or IgG, remain high after exposure. However, there is some indication that, and we've seen that before with patients that get IgE or IgG lab testing for food allergies, and they haven't touched gluten for a long period of time, and their levels of IgG or IgE is gonna be very low or sometimes non-detectable if they have not been consuming gluten. So just know this about ordering labs or seeing labs of patients that come to you with those IgG or IgE lab testing. If they have not been consuming those foods, it might not, before they taken that test, it might not be a good indicative of that, of their reaction, immune reaction. In food sensitivity, on the other hand, which is different, typically the immune reaction is much milder. The symptoms might develop slower over time, could be hours or even a day or two later. And then what we test for in food sensitivity is different. We test for the reaction of the white blood cells instead of immunoglobulin. And we tested with contact with food. So one of the tests that we look at is measurements of food sensitivity using cellular immune response. The test is called ALLERGY test or food sensitivity. It's relatively new, but there's a few studies that were published on it. And there's different opinion. It's not FDA approved currently. It's relatively still new. We refer to it as right now the gold standard in the functional approach. You can measure over 450 substance, foods, medication, herbs. And what they do is they test, they draw blood, filter out the white blood cells, and then put in those white blood cells in interaction with different foods and substances. And there's a computer system that monitors the reaction. So we're not measuring antibodies, we're measuring immune reaction. And this is how it looks like. It's very simple. You get from severe intolerance to moderate intolerance, mild, and then the green side, vegetables and fruits or foods that has no immune reaction. So what do you do when you get a test like this? Well, you want to take these patients off the severe intolerant food and the moderate intolerant food for at least 3 to 6 months while you can work on their gut function, integrity. You can reduce inflammation. You can help them to improve their function. The mild intolerance, I would want them to reduce as much as possible, right, as well. But definitely eliminate the severe and the moderate reactions. And it is associated, food sensitivity is associated, there's a few interesting studies. It's associated with digestion conditions, associated with metabolic conditions, such as obesity and inability to lose weight, chronic inflammatory conditions, such as asthma and arthritis, fatigue, and headaches or cognitive dysfunction. And that's mostly because if we're constantly irritating our immune system without knowing, right, because the symptoms are very mild and symptoms don't always develop right after eating those particular foods, then we might exhaust our resources, right, and lead to other conditions. So just remember that while food allergy or food sensitivity could trigger an inflammatory reaction. Now, this is the lab. Cell Science provides this particular lab, and collection is a blood draw. The kit can actually be ordered to patients, and they can go to the local lab or phlebotomy services available in most major cities, and then that could be shipped out to the lab. So if you're working with patients virtually, you can, in all major cities, they can have a phlebotomist and find a phlebotomist or go into one of the labs and fulfill this kit. When would I want to get this lab? Typically, I'll leave it for if we addressed everything else and we still have not resolved the patient's problems or symptoms or conditions, then we're going to look into food sensitivity or allergic reaction. Otherwise, we can just ask them to eliminate gluten for the duration of the treatment and reduce sugar, and of course not eat peanuts or anything that might trigger a reaction with them. So we want to eliminate foods from the severe and moderate reaction for 3 to 6 months, minimize foods from the mild reaction, anti-inflammatory foods and supplements, curcumin, omega-3 fatty acids, L-glutamine to moderate intestinal permeability and support the healing of the intestinal lining. We recommend to take on an empty stomach L-glutamine, typically from 2 to 5 grams per day at least. And then vitamin D is also great for helping in gut, reducing inflammation and healthier gut permeability in celiac patients. And of course, probiotics are wonderful. These are a couple of species samples. Bacillus subtilis, beneficial for strengthening the intestinal barrier. And probiotic bacteria Lactobacillus plantarum can also help regulate the tight junction, because what happens in many cases, as there's an inflammation, it also secretes zonulin and opens up the tight junction, and that leads to the proteins and bacteria to go into our bloodstream and cause more inflammation. So after treatment is complete, some patients might not be able to consume foods that trigger an immune reaction, and they might have to either eat small amounts of those foods if they really like them infrequently. But we had patients that even with doing working on their gut, reducing inflammation, within 3 to 6 months or a few months, they feel so much better. And then we just educate them and release them. We have found that sometimes they'll come back and they say, I was feeling so much better until I ate that food on my severe list or red list, right? And then all we have to do is typically just remove that food again and go back to some anti-inflammatory support or some gut health support, and typically within a month or so they get all better again. So just to let you know, some patients unfortunately will not be able to go back to eating those foods after the treatment.